What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video, we're covering the common knowledge of a regular patient on radiation and / common questions you'll be asked as an X-ray tech. So to give you context, I've been doing X-rays for 4 years. I do night shift, 7 on, 7 off, and I work a lot of day shift, a lot of overtime, making that money. So as far as the common folks, just a regular patient, you'll hear the same things. Okay? Depending on the situation. So I'll paint a picture. Pregnant lady. Right? We'll start with pregnant lady. Pregnant lady. You go in there, hey, we're going to here to get your chest x-ray. The doctor ordered one. They're saying you can't breathe, shortness of breath, or whatever you got going on. Pregnant lady. I'm pregnant. And we're like, sometimes it's obvious. Other times you have to ask. And sometimes you got to wait for results, right? And you're like, okay, I see that. So we have two choices. Either you can refuse the x-ray, or B, we can put lead over your tummy, or C, we can ask your doctor in case he didn't notice that you are pregnant, and then we'll get back to you. Those are the kind of three scenarios. And I'm not saying this. I just say this based off of my experience. Maybe it's just my doctors. Even if you're pregnant, the doctor's still going to want it. That's sad truth. Now, occasionally, if you don't look pregnant, or maybe they oversaw it, they'll be like, you know what? Let me do all these other stuff, and then we'll see if we can't get you better. Then we'll do x-ray. Sometimes they go that route. But majority of the times, even if you're pregnant, you're still going to get that chest x-ray. I've noticed. Because there's been countless times that I go, you know what? Let me ask the doctor. You know what? And it end up, they're like, just do it. Shield or whatever. We'll just document. And I'm like, my job as an x-ray tech is to inform both patient and the doctor so I don't get in trouble. Because if you shot someone, they're pregnant, you didn't even try to shield or tell anyone, it's going to be your honey buns who are in trouble, bro. Always document. Patient was pregnant. Doctor said I shielded patient. And if you can even show that you shielded, leave it on the picture. Even more proof that you attempted to shield, right? You have those patients who are very concerned about their safety and their kids and well-being, which, there's nothing wrong with that. You have that kind of situation, okay? Then we'll go to a different situation. We'll have someone in their 20s, my age, we'll say, for instance. Come in, chest pain, short of breath, whatever. So why do you step out when you do the x-ray? Why do I have to stay in here? And then we're like, okay, because, you're the one getting the dosage so you can be diagnosed or whatever. And they're like, well, I don't feel safe. And then we're like, because you stepped out. I'm like, well, we do hundreds, thousands of x-rays. If you would stay in there with you, we would get cancer. Like, we would get our thyroids blown. Like, we try not to be in there unless we have to shield, and then we'll let up in type situation. And, we always offer to give you lead, to give you this to keep you safe if you want that. So that's an option. You'll have the typical... Occasionally, you'll have, the rare-tuned Sheldon people, as we call it, who are physicists, and, they'll educate you on your machine. And you're like, you know what, sir? That is true. I read that in my x-ray book when I was in college. What you're saying about the cathode and anode and how it's spinning and it goes at the speed of light, I'm like, you are absolutely correct, sir. I've met one like that who was a physicist like the Sheldon. Even his lady was like, yeah, he's the Sheldon. And it was nice. It was nice, A little golden nugget to keep in my little heart, right? And then you'll have the ones who are x-ray techs, so they already kind of know the game, and they'll kind of educate you if they've even done film and stuff. So sometimes you'll have techs who have been, the godfathers, as I call them, of the X-ray department who've been around film, and they give you a little history and stuff like that. So that will be another kind of patient that gives you not really concerns of it, but just, educate you in the field and stuff like that. And then you have the typical, we're here to get a chest X-ray, and it'll be like a whole crowd of family, just young, old, everyone, and we're like, you need to get out. And they're like, why? And we're like, X-ray. And they're like, why? Radiation. And they're like, why? Radiation's dangerous. And they're like, why? And I'm like, it can cause cancer if you're pregnant. Da, 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 da. We give like the base thing, and they'll be like, oh, it's a good point. And I'm like, and there's young kids. Depending on the tech, depending on what's going on. If it's a young person or it's a kid, most techs, it should be all techs should get the baby out, get the kid out at least to keep them safe. If you, as an older person, and your right judgment still doesn't want to come out, that's on them. But them little kids, give them a chance. Like, no one under the age of 18 should be. No, just take them out. That's how I feel, and that's how I feel. Everyone in our X-ray should be it should. If they're not the patient, why are they getting extra radiation to them? Almost like the secondhand smoking type situation. Keep the baby safe. Because I've noticed it a lot of times, especially us who do morning ports in the middle of the night, and most patients are asleep. If I come in there one time and I'm like, hey, we're going to do X-ray on your wife, do you want to step out? And they're like, nah. If you told me nah one time, and you're still in there, I'm going to just keep on shooting the morning ports. Other patients will get mad at you because you tell them about that. Because I guess other techs before you have already told them the same thing. But you're like, well, I'm just covering my cheeks to make sure I don't get in trouble. Because the worst case situation is that X-ray tech didn't tell me that there was going to be dangerous radiation. And I feel that my neck, they'll whoop out some stuff concerning of their own. So give them the same spiel as everyone. It's better to keep safe and enjoy a long prosperity in this field than have one situation cost you your life. So yes, be with Miguel. See you on the next one.